Welcome to KenkoVibe, everybody. I'm Ethan Reed,
And I'm Grace Morgan.
and today we're going to be taking a deep dive into obesity.
Yeah, it's something that affects a startling number of people.
It really is, in fact, 2 out of every 5 adults in the U.S. are dealing with obesity.
It's true, and it's a really complex issue with a lot of misconceptions surrounding it.
Yeah, for sure. So we really want to unpack it, like what it actually is, what causes it, the potential complications, and how it can be treated.
Exactly. We're going to cover it all.
Awesome. Okay, so first things first, how do we actually define obesity?
Well, a lot of people think it's just about being overweight,
Right.
but it's a bit more nuanced than that. Medically speaking, we classify it as a disease where excess body fat can lead to other health problems.
Okay, so it's not just about how you look, it's about the potential health consequence.
Exactly. And to diagnose it, healthcare providers use a tool called BMI.
BMI?
Yeah, body mass index. It basically takes your height and weight into account to calculate a score. And that score helps determine whether someone falls into one of the 3 classes of obesity.
So BMI is like a starting point for figuring out if someone's weight could be a health risk.
Right. You could say that.
Okay.
So there's class I obesity, which is a BMI from 30 to just under 35.
Okay.
Then there's class 2, which is a BMI from 35 to just under 40.
Uh-huh.
And then finally, class 3 obesity, which has a BMI of 40 or higher.
Got it. So each class has its own set of risks and needs a slightly different approach to treatment.
That's exactly right.
Yeah.
Now, I know you've probably heard that BMI isn't always a perfect measure.
Yeah, I've heard that too. Like you could have 2 people with the same BMI, but one's super muscular like a bodybuilder, and the other person might have a lot more body fat.
You're absolutely right. That's why healthcare providers don't just rely on BMI alone.
Okay, so what else do they look at?
Well, they also take things like waist circumference into account.
Waist circumference.
Yeah, because where you carry your weight can actually be a better indicator of certain health risks than just your overall weight.
Interesting. So like even if someone has a normal BMI, if they have a larger waistline, that could still be a warning sign.
Exactly. It could mean they're at a higher risk for things like heart disease or type 2 diabetes.
Okay, so it's like putting together a puzzle.
Yeah.
You need all the pieces to really understand someone's health.
Now let's talk about the causes of obesity,
Okay.
because this is where things get even more complex.
Right, I was just thinking about that.
We've all heard that simple phrase, calories in versus calories out.
Right.
But trust me, it's way more complicated than that.
Oh, I believe it. If it were that simple, I think we'd see way fewer people struggling with obesity.
Exactly. There are so many different factors at play.
Like what?
Well, for starters, did you know that some medications can actually contribute to weight gain?
Really? So sometimes it's not even about the choices people are making. It's like a side effect of medication they need.
That's right. It can be super frustrating for people who are trying to manage their weight and then suddenly they're gaining pounds, even though they haven't changed their lifestyle.
Yeah, I can see how that would be discouraging. So which medications are we talking about here?
Well, certain antidepressants can lead to weight gain. Some steroids, anti-seizure medications, and even some diabetes medications can have that effect.
Wow. It seems like it's really important to talk to your doctor about any medications you're taking and how they might be affecting your weight.
Absolutely. And on top of medications, there are other factors that might not be so obvious.
Okay, like what?
Well, for instance, did you know that statistically, adults and children with disabilities are more at risk for obesity?
That makes sense.
Uh,
I guess depending on the disability, there could be limitations that make it harder to be physically active.
right. And sometimes there are challenges with accessing resources or even just a lack of awareness about how to adapt healthy living strategies to different needs.
That's a really important point. So we've got medications, we've got accessibility issues. What about just our eating habits in general? It seems like the world we live in almost encourages us to overeat.
You hit the nail on the head. We're bombarded with advertising for ultra-processed foods that are loaded with sugar-saturated fat and calories.
And they're designed to be so tasty.
Yeah.
Like you just want to keep eating more and more.
Exactly. They trigger those pleasure centers in our brain. Plus, portion sizes have gotten out of control.
It's true. You go to a restaurant and the portions are huge.
And then, of course, we have to talk about genetics.
Right, because that plays a role too.
It does, although it's often misunderstood.
So are you saying that some people are just genetically predisposed to gain weight?
There are certain genes that can make someone more susceptible to obesity, but it's not a guarantee.
So even if you have those genes, your lifestyle choices still matter a lot.
A lot. And speaking of lifestyle, we can't forget about the impact of screen time.
Oh yeah, the amount of time we spend sitting in front of screens has definitely gone up.
And that means less time being physically active.
Right. It's so easy to get sucked into your phone or computer, And before you know it, you've been sitting for hours.
And unfortunately, our bodies weren't made for that kind of sedentary lifestyle. We need to move to stay healthy, burn calories, and keep our metabolism working properly.
You know, something I've noticed is that when I don't get enough sleep, I'm way more likely to crave those unhealthy snacks.
It's not just you. There's actually a scientific reason for that.
Really?
Yeah, when you're sleep deprived, it messes with the hormones that regulate your hunger and fullness cues.
Interesting.
So you end up feeling hungrier, craving those sugary, fatty foods, and you just don't have the same willpower to resist.
So it's like your body goes into survival mode thinking it needs to stock up on energy because it's tired.
Exactly. And if that wasn't bad enough, stress can also contribute to weight gain.
Ah, yes, the infamous stress eating.
When you're stressed, your body releases a hormone called cortisol, and cortisol can increase your appetite.
Oh,
And guess what it makes you crave?
those comfort foods that are usually full of sugar and fat.
Bingo! It's like a double whammy. You're stressed, so you eat more, but you're reaching for the foods that might actually make you feel worse in the long run.
It's a vicious cycle.
Yeah.
And then on top of all that, there are underlying health conditions that can also contribute to weight gain.
That's right. Things like metabolic syndrome, PCOS, anxiety, and depression can all play a role.
Wow. It really is incredibly complex.
It is, and it's important to understand all these different factors if we want to effectively address obesity.
Absolutely.
Huh.
So with all that in mind, where do we go from here?
Well, next we should probably talk about the potential health complications that can arise from obesity.
Yeah, that's a good place to start. I think people need to understand why it's so important to take this disease seriously.
Exactly. It's not just about a number on the scale.
Right. It's about your overall well-being.
So let's dive into those risks.
Yeah, let's do it.
So we were talking about how many different things can lead to obesity.
Right. And it's not just about the weight itself.
It's about what that extra weight can do to your health.
Exactly. So let's talk about some of those health risks. What are some of the main complications that can come from obesity?
Well, as we mentioned before, too much body fat can mess with your metabolism.
Right.
It throws off your body's natural balance and leads to inflammation.
Inflammation.
Yeah. And also something called insulin resistance.
Okay, so remind me what insulin resistance is again.
Sure. So insulin is a hormone that helps your body regulate blood sugar.
Uh-huh.
But when you have insulin resistance, your cells don't respond to insulin the way they should.
So the insulin isn't doing its job as effectively.
Exactly. And that can lead to a bunch of problems. Often it results in something called metabolic syndrome.
Right, we talked about that a little bit earlier. So what exactly is metabolic syndrome and why is it such a concern?
So metabolic syndrome is basically a group of conditions that tend to occur together.
Okay.
We're talking high blood pressure, high blood sugar, abnormal cholesterol levels, and excess belly fat.
So it's like a whole package of health risks.
You got it. And having this combination significantly raises your chances of developing serious health problems.
Like what kind of problems?
Well, things like heart disease, stroke, and type 2 diabetes.
Okay, so let's break those down a little bit. Starting with cardiovascular disease, how does obesity increase the risk for heart problems?
Well, think of your heart as a powerful pump that's always working to circulate blood throughout your body.
Okay.
When you have obesity, it puts a lot of extra strain on that pump.
I can see how that would be a problem.
And over time, that strain can damage your blood vessels and lead to high blood pressure.
So it's like your heart is working overtime just to keep up.
Exactly. Obesity also makes it more likely for plaque to build up in your arteries.
That's called atherosclerosis, right?
That's it. And that plaque buildup restricts blood flow, which increases the risk of heart attacks and strokes.
So it's like your arteries are getting clogged up.
A good way to think about it. And that can also contribute to heart failure, which is when the heart just can't keep up with the demands of the body, right? It's like the engine is getting worn out. And on top of all that, obesity also raises your risk of developing fatty liver disease.
Fatty liver disease. What's that?
So basically, in fatty liver disease, excess fat starts to accumulate in your liver.
Okay.
And over time, that buildup causes inflammation, which can damage and scar the liver tissue.
So it's like your liver's getting overwhelmed and can't function as well?
Precisely. It can't keep up with all the extra fat.
Got it. And what happens if fatty liver disease isn't treated?
Well, it can progress to a more serious condition called cirrhosis, which can eventually lead to liver failure.
Wow. Okay. That's definitely something to be aware of. Now, what about gallstones? Those are supposed to be super painful. Are they connected to obesity too?
They are. Obesity is often associated with high cholesterol levels, and that excess cholesterol can lead to the formation of gallstones.
And what are gallstones exactly?
They're hard deposits that form in your gallbladder.
Oh, wow. So high cholesterol, which can be linked to obesity, can lead to gallstones.
Right, it's like a chain reaction.
It doesn't stop there, right?
Your catching on obesity also increases the risk of kidney disease.
Really?
How so?
Remember how we talked about high blood pressure and diabetes being linked to obesity?
Yeah.
Those two conditions are major risk factors for kidney damage.
So it's like this domino effect where obesity can trigger a whole cascade of health
Yeah,
issues.
exactly. And speaking of diabetes, we've mentioned it a few times, but I think it's worth explaining the connection in a little more detail. How exactly does obesity contribute to type 2 diabetes?
Yeah, I'd like to understand that better.
Sure. So it goes back to that insulin resistance we were talking about.
Okay.
When your body becomes resistant to insulin, it means that sugar or glucose can't get into your cells as easily to be used for energy.
Mm-hmm.
And that leads to a buildup of glucose in your bloodstream.
And what happens when there's too much glucose in your blood?
Over time, those high blood sugar levels can damage your blood vessels and nerves.
Yeah.
And eventually, that can lead to type 2 diabetes.
Exactly. So we've talked about heart disease, liver problems, gallstones, kidney disease, diabetes. Is there anything else we should be concerned about?
It sounds like a pretty long list already.
Well, unfortunately, there's more. Obesity has also been linked to an increased risk of certain types of cancer.
Cancer, too. Which types are we talking about?
Well, several types, actually, including esophageal, pancreatic, colorectal, breast, uterine, and ovarian cancers.
So this really is a serious issue that affects so many different aspects of your health.
It does, and it's important to remember that those are just some of the major complications. Obesity can also have a negative impact on your mental health, your respiratory system, your musculoskeletal system, and even your cognitive function.
Wow. So your physical health, mental health, and even your brain health can be affected.
That's right. It's pretty sobering, but it's also important to remember that even a small amount of weight loss can make a big difference.
Like how much weight loss are we talking about?
Even losing 5% to 10% of your body weight can significantly reduce your risk of developing these complications.
Okay, so that's encouraging to know. Even if you don't lose a ton of weight, every bit of progress helps.
Absolutely. And speaking of taking steps towards better health, let's talk about how obesity is diagnosed and treated.
Okay, that sounds like a good place to pick up after a quick break. We'll be back in a moment to discuss the diagnosis and treatment of obesity. Stay with us. So we're back and ready to talk about how obesity is actually diagnosed and treated.
Okay, so first things first, you need a proper diagnosis from a healthcare provider.
Okay, so you just go to your doctor.
Yeah, and they'll start by taking those basic measurements, weight, height, waist
This
circumference.
is more than just stepping on a scale.
Exactly. They're trying to get a full understanding of your overall health.
Makes sense.
And they might also use some more advanced tests to look at your body composition.
Okay, like what?
Things like a bone density scan or bioelectrical impedance analysis.
So those tests can tell how much of your weight is fat versus muscle?
Exactly. But probably the most important part of the diagnosis is a thorough review of your health history.
Okay, so what does that involve?
Your doctor will ask about any medical conditions, you have medications, you're taking family history, things like that.
So they're trying to see if there are any patterns or risk factors that might be contributing to your weight.
Right. They'll also want to understand your lifestyle habits, like what you eat, how much you sleep, how active you are.
So they're really looking at the whole picture.
And they'll also take your mental health into account, asking about stress levels, emotional factors that might be affecting your eating habits.
It's like a holistic approach, considering all aspects of your life.
Exactly. It's about treating the whole person, not just the symptoms.
Thanks, Seth.
They might also check your vital signs and do some blood tests to look for any obesity-related conditions and just get a better overall picture of your health.
Okay, so once you have a diagnosis,
Mm-hmm.
what are the treatment options? Is it all about strict diets and tons of exercise?
Not really. While diet and exercise are definitely important, it's not that simple.
Okay, so what's the approach?
It's about finding a plan that works for you, that addresses the root, causes your individual needs and your goals.
So there's no one-size-fits-all solution.
Nope. It's all about personalization.
Got it. So let's talk about diet first. What kind of dietary changes are usually recommended?
Well, the focus is on making sustainable, healthy choices, not those crash diets you see all over the internet.
Right, those diets never seem to work in the long run. You lose weight quickly, but then you gain it all back.
Exactly. It's a vicious cycle.
So what's the alternative?
Your doctor might recommend something like the Mediterranean diet or the DASH diet.
Oh, okay, I've heard of those. What are they all about?
They emphasize whole, unprocessed foods, lots of fruits and veggies, healthy fats.
Yeah.
It's about making healthy choices that you can actually stick with.
So it's about changing your eating habits for good, not just trying to lose weight quickly.
Exactly. And along with dietary changes, you'll want to incorporate regular physical activity.
So exercise is still important.
Yes, but again, it's about finding something you enjoy that you can fit into your life.
All right, I think that's key. If you hate working out, you're not going to stick with it.
You got it.
So diet and exercise. What else?
Another important aspect is mental health support.
Okay, how does that fit in?
Sometimes there are emotional and psychological factors that contribute to overeating and weight gain.
So therapy can be helpful?
Exactly. Things like counseling support groups or cognitive behavioral therapy can really make a difference.
So it's not always about willpower? Sometimes you need to address deeper issues?
And in some cases, medication can also be a helpful tool.
Really? Are there medications that can help with weight loss?
There are. There are medications that can suppress your appetite, reduce cravings, or even affect your metabolism.
Wow. So it's not just about willpower.
Yeah.
There are actual medical interventions that can help.
Exactly. But it's important to talk to your doctor about whether medication is right for you.
Of course. And what about weight loss surgery? I've heard that's an option for some people.
It can be. For people with class 3, obesity weight loss surgery, also known as bariatric surgery, might be something to consider.
What exactly does bariatric surgery involve?
It involves procedures that basically alter your digestive system to limit how much food you can eat and how much your body absorbs.
Okay.
Some common procedures are gastric bypass or gastric sleeve surgery. They can be very effective for weight loss, but they also carry risks.
Right, so it's not a decision to be taken lightly.
Exactly. It's a big step, and it's important to have a thorough conversation with your healthcare provider to see if it's the right option for you.
So we've got diet, exercise, mental health support, medication, surgery. It seems like there's a wide range of treatment options.
There is, and it's about finding the right approach or combination of approaches for each individual.
So what's the takeaway message here? When it comes to obesity, what do you want our listeners to remember?
I think the most important thing is that obesity is a complex disease, but it's manageable.
Right.
And there's no shame in asking for help.
Right. It's about getting the support you need to live a healthier life.
Whether it's through lifestyle changes, therapy, medication, or surgery, there are resources out there to help you on your journey to a healthier weight.
That's a great message. And we'll be sure to include links to some helpful resources in the show notes.
Perfect. And before we go, I just want to remind everyone that even small changes can make a big difference over time.
That's encouraging to hear.
So don't get discouraged if you don't see results right away. Focus on making those gradual, sustainable changes and celebrate every victory along the way.
That's great advice. Well, that's all the time we have for today. Thanks for joining us on this deep dive into obesity.
It's been a pleasure.
We hope you found it informative and empowering.
Absolutely. Knowledge is power, but only if we use it to make positive changes.
Couldn't have said it better myself. Take care of yourselves, everyone, and we'll see you next time on KenkoVibe.
See you then.
This is Ethan Reed.
And Grace Morgan.
Thanks for listening to KenkoVibe. If you enjoyed this episode, please subscribe to our podcast and leave us a rating and review. And don't forget to share it with anyone who might find it helpful. Until next time, stay healthy and keep those vibes high.